We go now to Maryland Governor Larry Hogan, who joins us from Annapolis. Good morning to you, Governor.
Good morning.
80% of hospital beds are occupied in your state. Omicron is really hitting hard. There are comparisons right now to where we were in 2020. Have you seen a real change in the ability of the federal government to respond to states like yours?
Well, so we have been impacted really hard over the past couple of weeks, and we reached a higher point than we ever did during the rest of the nearly 2 years of this crisis. We've got a little bit of positive news in that it's not quite a trend, but over the past 4 or 5 days, we've seen fairly dramatic decreases in both hospitalizations, positivity rate, and case rate. And so it's hopeful, and we're going to keep an eye on that over the next 10 days to see if we continue. But we're still in a pretty tough spot, and that's why I declared a state of emergency. We did a lot of things to try to help increase the capacity of our hospital system, sent in 1,000 members of the National Guard, and we're taking a lot of actions directly. And we're trying to get as much help as we can from the federal government, but quite frankly, they're falling short in a couple of ways.
How? What do you need?
Well, we've been pushing for quite some time. The president announced nearly a month ago, before Christmas, that he was going to distribute these 500 million rapid tests out across the country, and so far we haven't seen any. We were acquiring our own. The states have been on the front lines throughout this crisis, and now it appears as if, rather than producing more of these rapid tests, the federal government is just purchasing the ones that we had already contracted for. So now we're sort of hijacking the tests that we already had plans for, and we're now getting some of those providers to tell us they no longer have the masks, the rapid tests. On masks. I announced last week that we were delivering free of charge 20 million N95 and KN95 masks across the state, and
right.
I think the federal government is following behind, trying to do the same thing in other places.
Right. The president is expected to announce something in detail this week on that front. And I understand the CDC just changed their guidance or adapted their guidance on Friday regarding masks, but other states were out there, like Connecticut, distributing N95s earlier. Why did you wait until this point?
Well, we've been distributing them throughout the crisis, from the beginning, but the 20 million is a pretty huge number. So we've had unlimited masks for the schools for, more than a year already. We've got them out at health departments and hospitals, but now we're having even bigger reach because we realize that these masks are much more protective and that we've got a much more contagious variant that's spreading not only across our state, but across the country.
Yeah. In nearby West Virginia, their governor, also Republican, Jim Justice, has asked the CDC to authorize a 4th booster for the most vulnerable in his state. Are you going to do the same? Are you interested in that?
Well, 5 or 6 months ago, we did move forward on the 3rd booster ahead of the federal government because we had done our own antibody study in our nursing homes, which were some of our most vulnerable patients that we were very concerned about. The CDC, was taking their time, and so we're now doing another very similar antibody study in our nursing homes to see if we should move forward with a 4th dose, at least for our most vulnerable patients that are at risk.
So you're working on that. When it comes to
yes.
what's happening in schools right now, and I understand that this is district by district and the decisions are different, but Prince George's County, as you know, a district of Columbia suburb, went virtual right around Christmas. They're going back to school in person this coming week. You oppose that. You wanted kids in person.
Well, I don't oppose them going back to school this week.
But you oppose them going virtual. And in other parts of the state where they did go back in person, you had some lower attendance rates because people were sick. So why not allow for a little bit of flexibility there? Is there a time when virtual remote school actually is the best choice?
Well, there is flexibility with local school systems, but what we ought to do, and what the state policy actually is, if there's an outbreak in a particular classroom or a particular school, then they have certain protocols that they should take. But shutting down entire school systems to punish 1 million kids, look, we currently have 34 people in the hospital. 30 of them are children. 30 of them are children, and half of them are in for another reason in the hospital. We're now filling our empty pediatric beds with adults because children have not been that big of a problem. Our school systems have not been overrun. And, we started vaccinating teachers more than a year ago as a priority. That was what they asked for. We provided the masks. We provided hundreds of millions of dollars for filtration systems to try to keep our kids safe. And, I understand people being concerned about kids. We all are.
Yeah.
But we missed a year of learning in some cases, and it's absolutely not the way to go to keep the entire school system shut down.
Understood, but remote is somewhere in between. But I want to ask you about some politics here because, as you know, there's been a lot of talk among some high-level Republicans, including Mitch McConnell, the Senate Republican leader, who's trying to recruit you to run for Senate. You said you don't have a burning desire to serve in the Senate. You got a February 22nd filing deadline. If you don't want to tell me you're running or not today, can you at least tell me if a Republican can win a statewide federal election in Maryland?
Well, most Republicans couldn't, but both the Washington Post and the Senate leadership did 2 polls showing me beating Chris Van Hollen by 12 points. So I think it is possible. It's the same number that I was reelected by in 2018 against Ben Jealous as governor. But look, what I said, I've been saying all along. It's not something I aspire to, but I also have said that I care very much about the country and where we are and the divisive rhetoric, the divisiveness and dysfunction in Washington. And so, people are calling on my kind of more patriotic duty to say, even if it's not the job that you want, maybe we need you to run anyway. And so that's where we are. I've never expressed an interest in it and still haven't taken any steps in that direction.
February 22nd, are you going to run? Are you going to file?
February 22nd is like a month away, and right now we're just focused on the day job as governor and focused on this Omicron crisis and our legislative session. That's where my focus is going to stay. Okay.
Well, we will stay on top of you, and then we'll start asking if you're going to run in 2024, which you've been asked and said you won't comment on either. Governor, thank you very much for your time today, and good luck with the hospitalizations. We'll be right back.